Hi everyone, welcome to my Growing Young series again. And today we're very honored to have Dr. Kevin Moe here. Just a brief introduction. Kevin and I, we've been friends for quite a number of years now. And finally, on the 24th of April of this year, Kevin did a 6-hour surgery on me. So you probably noticed why I look so much better in today's program. Okay, so Kevin, can you introduce yourself?
Very briefly,
Yeah.
I'm Kevin, Dr. Kevin Moe, plastic surgeon, and originally born and bred in the UK. So I was born and bred in London. I did all my schooling, my university. I went to the Imperial College School of Medicine, graduated from there, and then began my training in surgery in the UK. Because my family is originally from Hong Kong, so about 20 years ago, I returned to Hong Kong. But then, obviously, when back then returning back to Hong Kong, lots of hoops I had to jump through. So we had to get recertified, had to do part of my training again, and various things. So then, for the last 20 years, or give or take, before I started my private practice, I was mainly practicing in both the university hospitals in Hong Kong, so both Hong Kong U and Chinese University. And then I then started my private practice about 6-7 years ago.
It was a full facelift, and I requested, more vertical than sideway because I prefer I don't want to change my mouth. I don't want to enlarge the mouth, and I just want a straighter jawline and a slimmer face, and my aesthetic is I go for obviously natural. I like to look good. I don't want to come out and people shocked, look at this result. But Kevin is very interesting because he just told me that the technique is more or less the same, but it's how much you pull.
Yes, pretty much.
So, okay. So, we've had very good conversation about, what my expectation is and what he can do. Actually, I was thinking about this surgery for quite a number of years now, at least 4 or 5 years. But 5 years ago, you said I wasn't a good candidate.
Back then, 5 years ago, I think I distinctly remember telling you, you didn't need it yet. I mean, basically, at that time, the difference would be quite minimal.
Right.
And I told you to wait.
Yeah.
I told you to wait because it was too early. Doing it at that point in time was not necessary.
Right.
The main element of plastic surgery is people have different tastes and people have different expectations, and even from surgeon to surgeon they have different tastes and aesthetics, which is very unique to plastic surgery, because in all other surgical specialties it's the same technique and it's done in the same way, and there's no like personal taste involved in any of it. So although the techniques are very same, you have to spend a lot of time asking each and every patient what they want, what they're expecting, and basically what kind of outcome they're looking for. Because as great as I think my taste might be, it might not be to everyone's taste. And no matter how much I think the result is successful, if the patient's not happy, then it's a failed surgery.
Yeah. According to Kevin, I am a dream patient and a nightmare at the same time. Can you explain?
Sorry. So I jokingly told William on numerous occasions, he's both a dream patient and a nightmare patient for different reasons. So he's the dream patient because he knows exactly what he wants. So therefore, patients like that, because they're able to convey what they want, it actually makes my job a lot easier. I either tell them what they want is possible, and I have a very clear idea what they want, or whatever it is they want, I tell them outright, I can't do that, I can't achieve that, and they know that very well up front. So knowing, like yourself, knowing exactly what you want makes my job very easier, because I have a very clearly defined brief. If I can't do something, or I think his ideas are too outlandish, I tell him like pretty much out straight that it's not possible.
The nightmare part.
The nightmare part is at the same time, because he knows exactly what he wants, then as long as we've agreed that that's the goal that we're trying to achieve, then basically being able to deliver is of the utmost importance. So the nightmare basically arises because he has very high expectations. He has also very high standards. So not being able to deliver is where the nightmare comes in. So there's basically not much room for trying to deliver suboptimal results.
That's why I chose Kevin, because he can deliver.